Afternoon. Undoubtedly, the United States is confronting remarkable economic and social challenges during the 2020 presidential election cycle. The COVID-19 pandemic continues to spread across the country, subduing our labor market and economic growth. Jobless claims remain at nearly 900,000 with little indication of recovery. Hospitals across the United States are also experiencing a third wave of patients as fatigue sets in and policymakers relax restrictions. COVID-19 has impacted communities in different ways. The pandemic has disproportionately affected minority communities, with Black, Hispanic, Latino, and American Indian Alaska Native persons being nearly 3 times more likely to contract COVID-19 than white persons. The United States has also witnessed a resurgence of attention towards racial justice, engendering widespread protests in major cities. With the looming presidential election, policymakers are still struggling to find a consensus on how to respond to the pandemic and ensure an equitable recovery. My name is Dr. Chris Kulasha, Research Analyst with the Child Health Policy Program at the Baker Institute for Public Policy. Welcome to our 2020 Election Series webinar titled Policy Movements and the Social Determinants of Health in the 2020 Election. This panel will explore healthcare disparities in the United States, the response to the pandemic in light of the 2020 presidential election, and how we may use policy to recover from the pandemic and economic downturn. I would now like to introduce our distinguished panelists and moderator. Today we welcome Dr. Sarah Wallace Goodman, an Associate Professor of Political Science at the University of California, Irvine. Dr. Goodman is the author of the book titled Immigration and Membership Politics in Western Europe, which won the 2015 Best Book Award from the European Politics and Society section of the American Political Science Association. Dr. Goodman recently co-authored a survey of over 3,000 Americans with Dr. Shana Kushner-Gadarian and Dr. Thomas Popinski, which demonstrated that partisanship is the most powerful predictor of coronavirus response. We also welcome former Health and Human Services Secretary Kathleen Sebelius. Secretary Sebelius was first elected to the Kansas House of Representatives in 1986. Following 8 years of service in the House, she was elected to her first statewide office as Kansas Insurance Commissioner, where Governing Magazine named her as Public Official of the Year for 2001. Secretary Sebelius served as the 44th governor of Kansas beginning in 2003 until President Obama appointed her as Health and Human Services Secretary in 2009. Secretary Sebelius is now the CEO of Sebelius Resources, LLC. Finally, we welcome Dr. Clyde Yancey, Vice Dean for Diversity and Inclusion, Chief of Cardiology in the Department of Medicine, and Magistrate Professor at Northwestern University. Dr. Yancey is board certified in internal medicine and cardiovascular disease. In 2009, Dr. Yancey was elected as president of the American Heart Association, and in 2016, it was elected to the National Academy of Medicine. Further, in 2020, Dr. Yancey was elected to the Association of American Physicians. For the past 5 years, Dr. Yancey was included in the top 1% for citations of all researchers in his field by Thomson Reuters. Dr. Yancey's recent research has brought attention to racial disparities in our COVID-19 response, finding that African American or Black persons are more likely to contract and die from COVID-19. Our moderator is Dr. Drew Armstrong, Senior Editor for Healthcare at Bloomberg News. Before joining Bloomberg News, Mr. Armstrong worked at Congressional Quarterly, where he covered Congress and the administration with an emphasis on health policy and politics. Mr. Armstrong began at Bloomberg News as a policy journalist in 2010, rising to deputy leader of the U.S. Health and Science team in 2010, and then to team lead in 2016, and became senior editor for healthcare at Bloomberg News this past August. Mr. Armstrong has led reporting of the coronavirus pandemic at Bloomberg News since the start of the year. I will now turn this over to our moderator.
Well, it's a real pleasure to be with everybody. Doctors Goodman and Yancey, it's very good to see you. Secretary Sebelius, I think the last time you and I met face-to-face was in Washington about 10 years ago when I was covering HHS, and you were in the middle of implementing the ACA. So it's a pleasure to be with you all. I'll also note that Chris was overly generous in calling me Dr. Armstrong. Dr. Armstrong is my dad. I'm still just Mr. Armstrong, but it is a pleasure to join you all from my basement while my 2 daughters have taken over the rest of the house as your moderator today. So I want to get started with a little bit of a table setting question, and I'm going to ask all of our panelists to kind of take us back through the pandemic. Specifically to answer, and this is something I'd love to hear from Dr. Yancey first on how this pandemic has in the United States kind of shifted both in geography and demographic since the beginning, when we saw the kind of first couple of rise of cases in some large international dense cities in the United States, through now, where unfortunately we appear to be in the middle of a third wave of infections, much more heavy community seeding around many different parts of the US. I think that'll be a useful way for us to kind of start off from where we've gone and where we are now, and hopefully have a big discussion about the communities that this has impacted, what the political implications of that are, what we can do about it, and what it means for the election going forward. So, Dr. Yancey, I'll kick it over to you first, and then we'll hopefully spend some time on this with Dr. Goodman and Secretary Sebelius.
Well, Drew, thank you very much. I want to express my gratitude to the organizers, to the Baker Institute, and to Rice University. As a former Texan, I feel more welcome than I would ordinarily feel in a setting like this. I also want to make clear that I am delighted to share this discussion with not only you, Drew, but especially Dr. Goodman and especially Secretary Sebelius. I think we will bring unique lenses to this discussion. Let me attempt to do what you set out. Let's see if we can't level set. We began to appreciate that just about a year ago, beginning in November, December of 2019, there was the emergence of an unusual respiratory virus that was particularly troublesome, leading to great consequence out of the Wuhan province in China. We've seen cases like this before, but very quickly we realized that it was a component or another entity of the severe acute respiratory virus, otherwise known as SARS. We had seen SARS once before. We had seen it in Toronto. We had seen it in the Middle East. We knew that it had a viciousness that we hoped would become self-limited. That was not the case. Shortly after the beginning of calendar year 2020, cases emerged in the United States, almost assuredly from international travel. The cases grew exponentially. Initially, we thought that this virus, which we knew was going to be a human-to-human transmission mode, was going to be limited to densely congregated or densely populated groups, like residents of nursing homes, prisons. But shortly thereafter, beginning in March especially, and by April, it was well established that the virus had a predilection for people of color. That seemed unusual. Why would a virus, first time ever actually, show a predilection for people of color? What we were learning from Wuhan province and what became aware to me as a cardiovascular journal editor, looking at the information in draft form that came across my desk to vet for consideration of publication, was this peculiar alignment of pre-existing cardiovascular conditions like hypertension, obesity, diabetes, and previous heart disease, either heart attacks or heart failure, with increased vulnerability to the novel coronavirus, which became manifest as COVID-19 or the coronavirus infections in 2019 when it was first identified. That awareness led to something that was even more troublesome. The consequences of developing COVID-19, again, seen initially in China, but later replicated throughout Europe, particularly Italy, was those same individuals that were most vulnerable became those individuals that bore the greatest burden of the condition. So by the end of April, we knew several things. This was a particularly vicious virus. None of us had seen it before, so we had no preset immunity against this virus. We had already observed the risk factors for developing the infection, and we had seen this very peculiar predilection for persons of color. The switch came on when we began to recognize in densely populated metropolitan areas, particularly Chicago, but also New York, even though it affected people of color, it was clustered in communities that have prototypically been those communities that have been marginalized. So much so that the majority of the episodes, the majority of the cases, the majority of the fatalities, Drew, were in just five neighborhoods in Chicago, meaning that probably place, as much as race, if not more so, was really the predictor or the most important variable to help us understand what was going on. Now we can fast forward to October, And I can simply share with you, this was replicated in Detroit, replicated in Minneapolis, replicated in New York, particularly in Hispanic or Latinx populations. And right now in El Paso, Texas, not far from where you are, although everything in Texas is far away, but you're seeing the same thing in El Paso, reviewing the data just this morning, that the Latinx population and the African American population in El Paso are 2 to 3 times fold more likely to succumb to this condition. And so it's interesting language. And you said we might be in the third wave. Those of us that are uniquely aligned with public health believe that we're still dealing with the first iteration of this. And because we haven't consistently practiced the kind of public health measures now proven to be beneficial, it's not just rhetoric, it's proven to be beneficial that if we wear face coverings and practice safe distancing, we can slow, if not halt, the spread. Because we've not done that consistently, we're still seeing the lingering effect of the first wave of this virus. And what has people like me and my peers in public health uniquely concerned is the looming twindemic. The flu season is coming upon us, and the next iteration of coronavirus will come upon us. We won't have the vaccine in time for the next iteration, so we'll need to go through this again. Hopefully the public health measures will be better. We do need to be compliant, adherent, rigorously so with the flu vaccination so we can lessen this burden. So the level setting I may have given us is a bit sobering, but it is in truth the way we need to start this conversation. Thank you, Drew.
Okay. Secretary Sebelius, I mean, I know you have been involved in pandemic prep previously. Is this type of spread that we've seen, in terms of its broadening geographic reach, something that I think you all would have anticipated at this point? I mean, when you think about where this disease is spread and how it's spread, I mean, was this kind of in the modeling for what you all anticipated in the past when you've been through scenarios like this?
Well, again, I want to start by echoing what Dr. Yancey already said. Thank you to the organizers. Delighted to be part of this panel and discussion, and look forward. I'm taking notes like crazy because I always learn something as I am able to talk to esteemed peers. So no one has ever seen anything like this. So there isn't any, complete anticipation. I would say our experience in 2009 and early 10 with H1N1 was a very different pattern, different disease, but a very different response. So what we're seeing today, I think, is totally unprecedented, not just that the virus is new, but that we are, as a country, in a partisan public health debate. And I think I can say, in history, that has never happened in the United States the way it has happened in this. And I go back to Dr. Yancey did a very good job kind of laying out how this evolved and what we know now about Black and brown communities and marginalized communities and densely populated communities that we didn't know, and what the key underlying factors are. But I would say a couple of things are layered on top of that. We have in this day and age a situation where starting in April, and I go back to a 2-day period on, I think it's the 16th of April, when we were still under a national stay-at-home directive. That was the only national directive really ever issued, and it asked everybody to stay at home to try and get the virus level down. And then the CDC put out very specific gated guidelines of what we should do to reopen, what the threshold was to go to stage 1, what stage 1 should look like, then what the threshold, and there were some components of that involving very massively increasing the testing, about having in place contact tracing regime ready to go in that state so that as people began to recirculate and viruses broke out, about what level was appropriate to begin to kind of unlock doors for people and have people re-engage, about what hospital capacity should look like at that point. I mean, a series of things that could be very effectively measured state by state, region by region, to then follow the guidelines into reopening. The following day, the day after the CDC, the ink wasn't quite dry on the guidelines. I'm not sure most people had read guidelines. The president tweeted, "Liberate Michigan, liberate Virginia." He picked 3 Democratic states and went right after the governors in those states with an insistence that those states immediately release the orders that were in place and immediately begin to re-engage in public discourse and activities. None of the guidelines were met in any of the states. Let me put that very clear, that in the states that he chose. But on that day, I think we began to see this partisan battle where scientists appointed by the President of the United States, sitting under the jurisdiction of the Department of Health and Human Services, were directly contradicted by the President of the United States. Guidelines that had very specific scientific goals and a very partisan response. And I think what we have seen from that day forward is a real quandary where if Dr. Yancey is to be followed, you'd follow science and guidelines. You'd take the steps that were important. We'd be talking about flu vaccine for everybody right now and massive vaccination campaigns. Everyone would wear a mask. Everyone would be socially distanced. Not only is that not happening, but the people who are identified still at risk are very much at risk. I live in Kansas, in the middle of a state where there aren't hugely densely populated cities anywhere, where the Black and brown population is a relatively small portion of the population. And the virus is raging here in very rural areas. The hometown where my husband grew up, less than 5,000 people, has a nursing home. 61 of 61 residents are positive. 100 cases in the neighboring prison have broken out. There are guards and staff everywhere. This is, I would say, an almost all-white area. They've already had 10 deaths in the nursing home, another 15 or 16 in the prison. So what we're seeing is a community spread that has really well outpaced the urban areas where it first started and was dense, and is now ravaging parts of the country where the capacity is not there. The town of Norton, Kansas has no hospital with an ICU. They do not have the experts to take care of people. So people are being transferred to regional areas. The regional areas are suffering. So we're seeing, I would say Dr. Yancey is right. We're a big enough country that what seems like a third wave is really just a first wave. It has now moved from West Coast and East Coast inward, from south to north and inward. And now we're seeing the Midwestern area be still ravaged by a virus that has none of the earmarks still of opening up the communities that the CDC put in place.
Dr. Goodman, can you put a bit of a political lens on this for us? I'm not sure if you're getting some echo from me. Hopefully that's disappeared there. But I think one of the things that's been, if you can help us kind of understand maybe the way that this virus has been perceived and debated politically, how it's been affected by exactly what Secretary Sebelius just described in terms of where it hit first and where it's hitting now. And then I'd like to kind of kick that open to a little bit more discussion of what we think this is going to mean for the election, because I have talked to friends in areas that were not hit hard early on. I live just north of New York City, and I think everyone here was hyper aware and very, very concerned. We saw what the impact of this could be, and you talked to other people in different parts of the country, either friends of mine in Kansas actually, or at home in Michigan, who were kind of wondering what the big deal was. How has that impacted how various different political parties or voter groups may be seeing this virus in terms of who has been hit hard, but also when they've been hit?
Okay, so I think I want to pick up on some of the points that both Secretary Sebelius and Dr. Yancey spoke to. Let me start first with kind of the political origins of this pandemic, right? So if we can revisit our minds February, it was both so long ago and still within the calendar year, right? So we're coming off the tails of an impeachment. We have a strong economy, and we see these clearly as what the president's interests are. as other countries start closing down, as we start hearing more about COVID, right? Now, in the early days, I'm co-authoring a book with my co-authors, as you mentioned, on pandemic politics, and we revisit this early period, and there was nothing inevitable about the idea that we would respond so politically. Typically, political science, we have these theories about external threat, and when external threat happens, it can be an opportunity to have bipartisan solutions, to rally around the flag, to come together, to unify. So the choice is really, it is a choice to meet crisis with a political response. And you see it now in Trump's very deliberate framing to say this is from China, this comes from China, the Chinese flu, right? To still keep it as that external threat to produce that sort of unified support. But early on, you see that was not a choice, or sorry, that the choice was partisan. And so really early on, you had early partisan responses. We ran survey experiments in March. So kind of just as states were shutting down. And if you changed, whether Republicans or Democrats would endorse pro-health behavior messages, whether Trump endorses or undermines it, like we had a bunch of null results that like partisanship, once activated, sort of was effective in informing people's health behaviors, their health attitudes, their views about what policy should be pursued, from immigration to trade, and that these attitudes and these behaviors endured. So when we start thinking about this as one long wave, right, that starts on the coasts, it moves inwards, moves to rural communities, we see that if you control for things like COVID prevalence in your community or where you live or age or income, that partisanship remains a consistent predictor of your health behaviors and your attitudes. And so we look at something like CDC messaging, the president actively undermining it, not just this example, but schools later on, or the same day where he did he say it? Did he tweet it? Right. I think it was tweeted, wearing a mask is patriotic. And then that evening was pictured, or the next day, not wearing a mask in public. Right. So it's sort of this messaging that never took, and just these partisan positions stuck around and endured. So that has remained a constant feature of this pandemic as we sort of crested and sort of the experience has been variable. But I mean, Drew, speaking to your point, right? So one of my co-authors is in Ithaca, and they have a very low caseload, but the schools are closed, I believe, because of strong unions. So even if your community is not sort of like directly affected by the virus itself, there are politics that are affected by the spread that have sort of permeated every community in America.
I want to. Can I kick something open just to the group here that you mentioned that I think is really interesting, just in terms of the kind of partisan fragmentation of the response to the virus.
Yeah.
I want to see if we can get both the whole panel, in fact, to respond to some of this, because I'm wondering how different demographic groups, both minority and underserved communities that have been very hard hit have reacted to this in terms of both adopting the public health messaging and how successful that has been, and what kind of the political reaction to them has been. I'd like to throw that open to the group if we can, because I think that is a very interesting facet of this. And after that, we'll follow up sometime on what that means going forward as well.
So I want Dr. Yancey to start. I think Dr. Yancey needs to start with some of this, and then I want to jump in a little bit.
So I'm happy to begin with this because it really opens up an incredibly important conversation, Dr. Goodman. So I'm glad that you gave us the segue. With my lens as an investigator, as a scientist, as a practitioner, as a physician, I think about the toll on human life and human suffering. Let me just be clear about this to close the loop on a comment that Secretary Sebelius started. University of Washington just today estimated that by February of 2021, over 500,000 Americans will have died. 500,000. And so any language, any thoughts, any commentary about we're hitting the peak or the azimuth and we're about to settle down, that's not correct. this is going on relentlessly. I want to be certain we get that point across. I say that because my lens is about the human existence, about the human experience. And I've seen the suffering and I've seen the pain. But to respond to your statement, Drew, in communities that are marginalized, let me give you some statistics that are pretty striking. We all heard the conversation about the essential workers needed to continue to go and provide goods and services to keep us going, to keep our infrastructure functioning during the earlier months of this crisis. The persons that populate the essential workers are Black and brown communities. If you take in aggregate all Black people, look at all essential jobs, 8 of 10 essential jobs are held by either a Black or brown person. So those are the people that we insisted needed to go back to work. Secondly, the people least able to work from home, were those in the service industry, the people that had no hardware, had no opportunity, had no facility to do a Zoom call, either had to show up to work or not work at all. Disproportionately Black and brown people. Now, finally, when we really think about this burden, we begin to understand that the second wave of coronavirus, COVID-19, is not the resurgence of COVID-19. It's the economic calamity that awaits Black and brown communities. It is the abject loss of resources, the looming desperate poverty that will face all of those communities. This is a monumental challenge because it's no longer about public health. It's about essential necessities of life that are rapidly evaporating from these communities. So, do they have time to be politically active? I think not. I think right now everyone's trying to find a way to maintain a livelihood as best as possible. So when you raise the question, Drew, what is the outsized disproportionate burden on minority communities? That's it. They're not bracing for the second wave of COVID-19. They're not thinking about the influenza vaccination. They're thinking about sustenance, which is now challenged because the jobs that most of them held are the jobs that were at risk, and they were the least likely people to be able to work from home. And I wouldn't be fair if I didn't say, as challenging as this is for Black and brown communities, what's happening in indigenous populations and Native Americans is one word: tragic. Tragic. Tragic.
I would be a little harsher than you, Dr. Yancey. I think it's criminal.
Yeah.
It is something that could be avoided, and it's intentionally not being avoided. So I put some blame. I just wanted to add a thought. Dr. Goodman, I think, laid out some of the issues around how partisan response is impacting issues and how party affiliation may be influencing behaviors right now. I think it's important to look at the fact that, epidemiology, that the tracking and tracing of diseases, the mirroring of what is happening, and then effective response. One of the cornerstones of epidemiology is communication, clear, consistent, trusted communication, and the trust that goes with it. So that's an element that really, I think, has been severely undermined. And I think it's important to talk about because I think it's fair to say, particularly in the Black community in this country, for very, very good reasons, there was already a mistrust of the healthcare system, the healthcare professionals, which often did not serve the Black community well, where they were used too often in experiments or as objects of, some kind of testing strategy, not access to the highest quality, most consistent healthcare, a lot of cultural barriers, and the Hispanic community was added to that, where there are lots of issues around, do we trust these folks? Do we have community confidence in the healthcare system? So that already existed. A trust factor, I think, was divided even in, the healthiest times. These were the most likely to be uninsured, the most likely not to have a relationship with a provider on a regular basis, et cetera, et cetera. So you add to that then a disease that's ravaging the United States. And as Dr. Yancey said, people on the front lines of that disease are often in the Black and brown community, unable to take the steps to socially distance, or living in more densely populated, told to go back to work, or you lose your job. And we then have the communication, which has to be part of any public health response, any united public health response. I know, in our administration, we had a very new president within months of his being sworn in. He's not only dealing with an economic downturn, but then the pandemic is layered on top of that. The pandemic didn't cause the economic downturn. He got the downturn as part of his swearing in ceremony. And then, this novel flu begins to show up. But what he said from the very beginning was, we got to trust the scientists. Whatever they say, we're going to do. And I can tell you that there were lots of political people around him that said, oh my God, you got to do this. You got to appear strong. You've got to do this. You got to close all the schools. You got to open all the schools. You got to shut down all the jobs. You got to do this. And he would say over and over again, tell me what the CDC says. Tell me what the NIH is saying. We are going to follow that. We are going to listen to the scientists. And I think that one of the things that we can't diminish about the horror show that we are still experiencing, and that unfortunately is a long way from over, and certainly the economic toll is catastrophic, is that the public trust in health institutions is not going to be solved by an election that will maybe begin to restore it. But we've done serious undermining through this communication that has been so mixed and garbled and intentionally lied to the American public, where I really worry about when there is a safe and effective vaccine, can we get anybody to step up and volunteer? Can we get the people who are going to be most likely to be affected in a health situation to be on the front of those lines to get vaccinated? I think there's a real issue about how we are ever going to mount an effective vaccination campaign, which is the first step to getting some of this virus under control, if people don't trust the message that they're hearing, if they don't trust the messengers, they don't trust the public health officials, and they think once again they are being used and abused by a system that they don't trust at all.
And so even before COVID-19, Drew, even before COVID-19, these were the communities that were incredibly reluctant to accept proven to be effective vaccinations for influenza. They would much rather take their chances. Now you overlay that with all of the political heft of COVID-19, and there are people that are saying, there's just no way I'm taking that vaccination. It's came out on too fast. It's too politicized. Let somebody else do it first. And these are the people that precisely need to experience the vaccination. And so we have really positioned ourselves in a conundrum. I mean, the partisan discussion is something that I'm thinking about, and I'm listening, and I'm taking Secretary Sebelius's lead and making notes here. But there was something that was penned in a highly regarded medical periodical recently that I thought was unbelievably prescient. And it was simply this: truth is neither liberal nor conservative. It's the truth. And truth should guide our actions. And our actions have not been guided by truth. Because for something like this, the truth is actually in my domain, in my peers' domain. It's in the science domain. That's where the truth resides. We've been able to inform the community theoretically about what needs to happen next. And that has not been sufficient to inform things.
The vaccine hesitancy that we're seeing, there's some really interesting polling data that's come out over the last few months where, Dr. Yancey, some of the attitudes that you mentioned that have been historically present in some of those communities, you're now seeing, large portions of the American public express exactly some of those sorts of opinions. And I'd wonder, Dr. Goodman, Secretary Sebelius, Secretary Sebelius, you've been obviously led HHS, you've been an elected official, and how much of this feels like heat of the moment electoral politics kind of rearing their head, where there's just a tremendous amount of political heat around the president, and how much of this vanishes, once the election is over, no matter who's in power, and how much of this vaccine distrust and the growth in it feels sustained and real.
Well, I think nothing vanishes. Let's start there. I mean, we are going to have an election in 9 days, and hopefully the president, assuming there's a change in administration, that doesn't happen till the end of January. And then you have all of the issues that Dr. Yancey and Dr. Goodman and I've described, where you still have a virus raging, you still have not mounted a national vaccination campaign, we still have this economic tragedy continuing to, pour out, and Congress is totally stuck on any kind of additional help right now. So nothing is going to vanish. I think that what we had in an earlier day was a growing number of anti-vaxxers. And you've seen that group rise. You see moms and parents who are refusing to get their kids' measles vaccine. So we've had a measles outbreak again in the United States, something that I thought we'd never see again in this country. You've seen, as Dr. Yancey said, last year, only 46% of adults got a flu shot last year before the virus. And so you've seen a diminished level of engagement. And part of that is there hasn't been a great public health message for 4 or 5 years. There hasn't been a real effort to go after folks. There hasn't been a real discussion of science and how important it is. But that was growing prior to COVID-19. And now when we're in these tribal communities, if you will, around whose expert is right and wrong, we have a president, I'm afraid, who will never admit that he was wrong, who will never, ever admit a mistake. And so that goes on. That will continue into the future. What we can only hope is that we have a national communication strategy that then backed up by governors, backed up by mayors, backed up by local health officials, community, trusted neighbors, pastors and priests and rabbis, moms communities that do a massive outreach, basically saying, we will never get out of this until we all step up and, become part of the vaccinated group. But until that happens, I'm afraid we will just continue to bat this ball around and not be able to go on our ways. A missing national response is irreplaceable. That's what we've seen. You cannot communicate a clear message on a state-by-state basis or in the from city to city. You have to have a message that drives from the top down, and then a consistent group of athletes, scholars, doctors, advocates, healthcare providers, parents echo that message. But we've never had that.
Dr. Goodman, what do you make of this polling data? Because I think we've, in addition to kind of Democrats who might distrust the president, pushing for a vaccine before the election, so on and so forth, I think some of those numbers have also shown that there's hesitancy amongst Republicans as well. What do you make of the growth of some of these numbers?
So there's a couple things happening here. One, as mentioned, is this decline of trust. So you look at how the CDC was rated in November of last year, really highly rated government institution, among the highest, right? And that has taken a real hit on both sides. And that's not to say it isn't warranted, because there have been some very public missteps by the CDC since February, right? But that said, there were many opportunities for the president to put public health messaging front and center. But when we saw in the day, the long days of April, the coronavirus task force, it was political figures speaking primarily, followed then by Dr. Birx, Dr. Fauci, right? It was political message followed by health experts. I'm a comparativist. I study Europe traditionally. And that's very that's very atypical to make these health messages primarily political. It's almost always public health experts, doctors. Dr. Redfield would have been a prominent figure in March and April, and we didn't see that. And so that also contributed to the decline of trust in public health experts, which is only amplified in Black, Indigenous, and communities of persons of color, right? With increasing distrust, not just of public health officials, but doctors in particular. So, on the one hand, there was this sort of decline in trust, which was never re-energized or put front and center. And second, I would say, is that this features as part of one of the central themes of the Democratic platform for this, for this election, right? One of, on day one, Biden says he's going to have a national mask mandate. We don't have a national mask mandate, right? I mean, that's also very atypical among, the number of countries that didn't do that also stand out. It's like the UK and the Netherlands, and then it's us, right, who just did not adopt a national mask mandate. And so you see this huge variation, even though we know and have known that masks reduce the spread, right? And this is something that the CDC has changed opinion on, but somehow, and this I would say, right, I guess in the tradition, I'd go even further here and say that it's really criminal to put out the idea that you can't update your information and learn new things as time goes on. It's not admitting that you're wrong, but it's admitting that you can learn. And so when you get to this, we raise this point about the truth as being nonpartisan. So, so is learning, right? And that's a part of this novel coronavirus as well. That's why it's novel, and that we've stigmatized learning also as part of the sort of the politics of this is incredibly upsetting.
Well, I just want to throw in one data point.
I want you to jump in here, but I got to do a quick housekeeping note for everybody. Okay. There is a Q&A section that we're going to hit in a couple of minutes. So if any of our audience members have questions, I want to make sure our panelists get a chance to answer them. Go to the right-hand tab, upper right-hand tab. You can enter your questions there. Madam Secretary, sorry to cut you off. Please go ahead.
No, I wanted to give Sarah a real live data point. I live, as I say, directly. We are, if you had a target on a bullseye, Kansas is the target. It's front and center, north, south, east, west. We're directly in the middle. We have a Democratic governor and a Republican majority legislature. We have seen this issue play out real time. Governor issues a statewide school shutdown, one of the first in the country. That worked. Step two was a statewide mask mandate. The legislature comes in and says, we're not going to have a statewide mandate. We are going to have regional or local statewide mandates. The areas in this state, and we can track it pretty well, that had a mask mandate in place have done much better than the areas that, like the one I just described, further west, smaller communities, but the virus hit there later. No mask mandate in place, still no mask mandate in place. And we're tracking that around the country. So the partisanship not only started at the national level, but played through, you had a Democratic governor in Michigan and armed protesters standing outside her office and a legislature upsetting it. You had a governor in Wisconsin and the legislature overturned the public health rulings in Wisconsin. So we have had a battle that, at least in my experience, and I've served in a state legislature, I was a governor, I was at HHS, I've never seen that kind of breakdown on a public health response. I've never seen this sense that we really are going to take whatever the best science is, update the science as we go along, and follow the science. I think all of us are seeing for the first time this incredible breakdown in our communities. And the brunt of it, as Dr. Yancey eloquently said at the beginning, unfortunately is falling on the not only the Black and brown community, but the first American community. And we're seeing them being ravaged, and it's still going on.
Can I ask the group? Yeah.
Sorry, just wanted to get back. Really quickly, I wanted to get back to a point of yours. You asked what's new, right? So we can think back to like the polio vaccine, and when the government tried to mandate polio vaccine distribution in schools, people call that socialist, also, right? And so, I mean, the idea that people should be vaccinated, like, it has not always been sort of like widely embraced. There's always been people that oppose it, but there's another element that makes it new, and not just sort of this partisan response, but really the role of disinformation. And this is both foreign and domestic in origin. And we have really strong evidence that shows how this information gets disseminated online, and that this feeds sort of misinformation campaigns that are really pernicious and damaging to our public health goals. I just wanted to put that
Can
up.
this is a question for the group again, and maybe we can start with Dr. Yancey. How has this pandemic been motivating or demotivating from a politics and voter standpoint with the communities you all either work with or study? Because I think one of the things that has been interesting to me as an observer of this election season is that the feelings on both sides are tremendously strong. You know, Secretary Sebelius mentioned the folks storming the Michigan state capitol. You know, my home state where I grew up, which says, you know, it's not as if one side is taking this seriously and the other side is just ignoring it. It appears to be that there are aspects of this pandemic that are very motivating, even if in opposite ways across the political spectrum and across demographic spectrums. I'd be curious to hear what you all have either heard anecdotally or in the data that you've seen. Dr. Yancey, maybe we can go to you first. You know, given some of the communities you work with and that you study, what has been the reaction to this that you have seen? You know, as Secretary Sebelius points out, 9 days away from an election.
So again, you need to appreciate my lens. All of my peers, all of us are sworn. We take an oath that we will do everything we can do to preserve the human condition. We take an oath that we will not engender harm. And regardless of our individual political persuasions, we see the pain and suffering firsthand. And I have been overwhelmed at the esprit de corps, the courage, the self-sacrifice that has occurred by scientists and practitioners, doctors, nurses coming together at their own risk to try to make a difference. The part of this conversation that gnaws at me is, what part of death do we no longer understand? What part of death do we no longer understand? If it is correct that by February we'll have over 500,000 deaths in less than 12 months due to COVID-19, that is 10 times the Vietnam War, 10 times. What part of death don't we understand? What more needs to happen to galvanize that sense of unanimity in our response to, for certain, an external threat, as Dr. Goodman stated? And so there is a disconnect when I see the reality as a scientist. But when I extricate myself from the science community, then I see the polarization. And I see, even more important than the polarization, the absence of leadership. You can adopt any entity, enterprise, system you wish. In the absence of leadership, it fails. It fails. And that's what our country is facing now. Our public health sector is failing. Our bedside care for patients that are critically ill will fail. Our economy is at risk of failing because there's this vacuum of leadership. But if I go back into my scientific space, I recognize that one of the few paths we have out of this is to quickly define a vaccine that will work, to redouble our efforts with a very plain spoken, very palpable public health message. Use survivors if necessary. We have to do something different. If we continue to do what we've done before, it really will lead us nowhere. But we have to understand that this moment, this election, is our opportunity for a pivot, an inflection point. We need to take advantage of that. The leverage of this dialogue, a dialogue that I hope is happening everywhere, that is saying, folks, we're not out of the woods yet. Here's the thing that gets me as a scientist, as a clinician scientist. We don't even have 12 months of data. Virtually every other condition I treat, study, author publications, vet publications, we can talk about years of data. We know the natural history of this. We know what happens a year after a heart attack, 5 years after a heart attack. We don't yet have the first person in whom we can say, this is what you can expect at 1 year. I mean, I really applaud Dr. Goodman for saying that Just like truth is neither liberal nor conservative, learning is neither liberal nor conservative. And there's a lot about which we need to learn right away. And so there are communities that need to appreciate what's really driving the scientific community here. This is an unprecedented amount of death. And that really prompts an action that we've not seen yet. You heard Secretary Sebelius in the middle of Kansas, in an all-white community. You've got tens and tens and tens of people developing this disease. And oh, by the way, we've been part of the science community that's begun to describe potentially the longer-term consequences, the cardiac consequences, the neurological consequences. This is not a trivial illness. There are more dimensions of this that we've not yet explored, and we should begin to take this in a different way. Let's use this election as a pivot.
Dr. Goodman, I'm wondering if I can kick it over to you for how this has kind of motivated voters in one direction or another, and then I have a question from the audience that I'm going to ask Secretary Sebelius right after that answer.
COVID not only sort of affects every aspect of this election, from sort of the way that the campaigns operate to the substance and the number of debates, right? I mean, it's ever present in the campaign, but it's also affecting how people vote and voter turnout, right? So we already have evidence that more Americans have voted early or absentee in the 2016 election. So already we have unprecedented turnout among early voters. There's been important shifts in terms of whether people think that voting by mail is a source of fraud or not, right? So that was a key talking point in August, right? In July and August. But I think the evidence that both Republicans and Democrats are turning out shows that that's kind of an unfounded rumor that didn't take even among co-partisans in Trump's party. But also, one of the things political scientists worry about as relating to COVID in this election is sort of the uptick in violence, not just violence at the polls and voter intimidation, but the notion that whatever the outcome, if it's not your preferred candidate, your view is that the election is illegitimate. So that's like it's another worry, I guess, we can add to this mix here. I don't sleep well already, so I'm happy to convey some of that to you. Yeah, but people are voting by mail, and these long lines that we're seeing in New York and Georgia, like, that's evidence of enthusiasm, it's evidence of concern, but it's really evidence of voter suppression. It's really evidence of sort of a new kind of poll tax that we have to make it harder for certain people to vote.
Secretary Sebelius, one of the questions we have from the audience here is, how can health advocates and public health individuals retake control of the conversation and build back missing trust again? And I want to add to that, how do you do it in a way that, let's say Vice President Biden does win this election, that it rebuilds trust across the political spectrum, and you don't end up just with a situation where now, people who voted Democratic believe what's coming out of the administration, but the other side doesn't. I mean, I don't think anybody wants this to be a situation where the belief in public health is going to depend on which party is in the White House at a given time.
It's a great question, and I think it's something that a lot of us worry about a lot. And I think it starts from the fact that the way disasters, and if you see this as a disaster, is supposed to work, is you start at the local level, you call on the state for more resources when the local level can't respond effectively, and then the state calls on the national. That's why a disaster declaration is asked for. The state doesn't have enough resources and it calls on the national. With the exception of something that hits the country simultaneously, and then it goes the other way, where everybody has always recognized that it starts at the national level, and resources, logistics, help, money flows down, because no one could expect one city or one state to be able to deal with this, right? It starts the other way. I'm hopeful that if we have a change in administration, first, there will be a very clear national plan immediately beginning to be articulated. And then people have an opportunity to echo that, to endorse that, to work at the local and state community level to gather trusted allies from the medical community, from the faith community, from the advocacy community, and begin to, again, reach out, reassure, meet face to face with folks to echo what is coming as a global strategy. I think it can work. I think in many ways, the governors and the mayors who have been thrust into a situation they didn't ask for, they didn't have the capabilities to deal with it. I've been a governor. I can't imagine being in the situation of being told, for instance, go find your own protective equipment. Yeah. Figure out your own supply chain. Figure out what tests you can, get in your own state. Nobody wants, even an elected official who's doing a very good job, they don't want to do that. I do believe that a number of the Republican officials have been in the uncomfortable position of trying to balance what they see ravaging their state and trying to be loyal to their party, trying to be, and some of them fearful that they won't get the resources they want and need unless they echo kind of a party line. I do think there will be a sense of relief even at the public level once that message goes away, once you have a consistent notion that we at the federal government own this. We will be accountable for it. We are going to work as hard as we can, as fast as we can, in any way that we can to get you the help and supplies you need. I think that will come as an extraordinary relief to even a number of the public officials who right now seem to be adversarial, but in their heart of hearts really want their citizens to be safe and secure and know they don't have the capacity to do that. So public health officials, I think this could and should be a post-9/11 moment where we have had laid bare not only the gaps that we have in the public health system, not only the chronic underfunding that isn't new, but it got much worse with the last recession in 08 and 09, and it's never been rebuilt. The public health departments across this country took at least a 25% cut, some of them a 50% cut, never have been refilled as the economy began to recover. And we don't have the infrastructure for prevention, for outreach, for particularly underserved communities that we've needed. We don't have things in place to really address the social drivers of health in communities that desperately need it. We don't have the food security and transportation assistance that we need. So my hope is that we will have a reckoning as we come out of this that won't just be part of the public health reckoning, but an economic, societal reckoning to begin to rebuild not just public health systems and trust in public health systems, but the elementary building blocks of a healthier, safer America. We've never seen quite as starkly a situation where health is a security issue. Health is an economic issue. This nation cannot be prosperous and secure going forward unless we get the health of all of our communities straightened out.
So let me make a segue from that very poignant statement, the post-9/11 moment, because we really are in need of that. One of the things that's a driver right now is that it has become painfully aware to all of us that the absence of health in any one of us threatens the health in all of us. The title of today's seminar was really to think about the social determinants of health and how they influence not only health outcomes, but our economic fiber, our country's ability to prosper. And what we have learned in a very clear way is that in communities that don't have adequate transportation, that don't have adequate economic opportunities, that don't have adequate appropriate jobs, that don't have appropriate housing, that don't have access to fresh fruits and vegetables, healthy foods, those communities that have been marginalized and have experienced a disinvestment are exactly where we've seen these conditions evolve. And it's human to human transmission. The issue is not that groups of people like to live together. That's a cultural decision. The issue is that by living together, so many of them have clustered their social disadvantage, and then systematically their communities have experienced disinvestment. I mean, I'm trained as a scientist, as a physiologist, and here I'm painfully aware that it's public policy that is driving health outcomes like we've never seen before. And so it means that we have to go back to the public venue and say, realize that our decisions have consequences. And if we are to thrive as a country, not as a disconnected set of individuals, which has been postulated by some, but if we are to thrive as a country, we need to go back and revisit what we're doing with public policy to secure the very foundation of who we are. And I think that's not been taken very seriously up until now.
I hate to have to cut off our discussion, but we are right up against our time limit. This is too bad because there's actually several good questions in the Q&A I wish we could have gotten to. I want to thank Drs. Goodman and Yancey and former Secretary Sebelius. This has been a pleasure. I could have kept it going for another half hour, but I know all of you are busy, and I want to respect our audience's time as well. So I'll hand it back over to Christopher.
Well, thanks so much. So on behalf of the Baker Institute for Public Policy, I would like to end this event by thanking our wonderful panelists, Secretary Sebelius, Dr. Yancey, Dr. Goodman. Thank you to our excellent moderator, Mr. Armstrong of Bloomberg News. And thank you, of course, to everyone attending our webinar. Please follow us on Twitter at Baker Institute and on Facebook. And please subscribe to our newsletter on our website, bakerinstitute.org. Have a wonderful week. Take care.